Good afternoon. My name is Praveen Kanda. I'm the VP of Intellectual Property and Innovation for MTBC. And welcome to the third webinar on the MacBoard series hosted by MTBC. I'm joined with our medical consultant, Dr. Gupta, today, who has been our medical advisor in terms of EHR developments, and also who is currently helping us consult in healthcare IT issues and also healthcare IT situation in the market. Today, we'll go on to part 2 of our discussion on the timeline to successfully achieve ICD-10 and Meaningful Use Stage 2 in this year, which is 2014. So I will begin first by asking Dr. Gupta, can you please explain the common features in both these rules that the providers have to know for ICD-10 and Meaningful Use Stage 2?
Hi, Praveen. And in previous webinar, we did talk about the Meaningful Use 2 and Stage 2, how are they work together, or what features are there that actually help both of them achieve improved patient care. What we're going to focus on today's webinar is talk about what are the real common features from implementation guideline, what we need to focus on so that we can implement both Meaningful Use Stage 2 and ICD-10 together, because they have many common features. When we're trying to look for an EHR, even for Meaningful Use Stage 2 or ICD-10, you need to make sure that your EHR system support structured problem list, patient clinical data, computerized order entry use, clinical decision making, and also has ICD-10 codes. The improvement in practitioner clinical documentation practice and workflow are the key element of both the systems, both the directives, both the federal directives, because the workflow change is going to make a big change in how you will be able to implement both the directives in 2014.
And one of the things MTBC would like to announce at this stage is that our web EHR does meet these requirements. When Dr. Gupta was talking about the structured problem list and patient data, our system is mostly text-based. However, there are few requirements in our system to meet Meaningful Use Stage 2 where you actually have to put in your data as structured data, where you can select each individual allergy or immunization or even a ICD problem list in our system. In addition, we also use computerized order entry, especially in the use of pharmacies' medications, and to e-prescribe. So using SureScripts as our back-end provider, we allow providers to use our EHR and e-prescribe using computer order entry use. Finally, we do offer clinical decision-making tools, and we plan on interfacing with other organizations to offer more tools that help providers make their decisions. Currently, we offer PDR, which uses their technology in medications to find out more about each medication, and eventually we will be using other vendors to provide clinical decision-making tools for our providers. And as I mentioned in our previous webinar, MTBC's web EHR will also be ICD-10 compatible, where you can select ICD-10 codes. Now, Dr. Gupta, can you please go into a few of the elements in terms of planning their ICD-10 implementation with MU Stage 2?
The key thing to focus and really understand that to be able to implement both ICD-10 and Meaningful Use Stage 2, it's a lot more has to do with each practice and their workflow and their goals and objectives and their preparation and planning and how they achieve it. EHR vendors, software companies can help you, but they are not responsible. It's ultimately you. So key thing to focus on here is make sure you align the three main components of implementation: technology, people, and your workflow together, so that you achieve both Meaningful Use Stage 2 as well as ICD-10, because there are many similarities. You don't have to reinvent the wheel by doing both two separately. If you keep both the features in mind and try to create a workflow that will include both ICD-10 requirements as well as Meaningful Use Stage 2 requirements, you will achieve easily. And we're going to focus on each one of them component individually now. So let's first talk about technology. From technology point of view, we all have to make sure when you're getting an EHR vendor, EHR software, that they are 2014 certified. You also have to make sure that this EHR supports ICD-10 or the EHR vendor has planned to help you with ICD-10 and provide you ICD-10 codes. And this is the key important. This support is useful for you, but this alone is not going to help you. So you really need to focus on next component would be people. And that is the key area to focus on. In order to implement ICD-10 Meaningful Use 2 stage 2 successfully, we have to make sure that you bring together the stakeholders in your practice, whether you're physicians, nurses, revenue cycle managers, billers, coders, etc., who have common roles in both the programs, Meaningful Use Stage 2 and ICD-10. Bring them together, work with them, create a timeline, establish a project plan which will involve all the stakeholders. It may also involve their training so that they can understand how does the ICD-10 interplay with the Meaningful Use Stage 2, such as clinical documentation improvement and coding accuracy. Those two are very key components both for ICD-10 and Meaningful Use Stage 2. And you also have to make sure that the key stakeholders, your super users that you have in your practice, play a lead role in program planning, implementation, and driving compliance. These people who are really the super users will be able to implement, will help you plan, will help you point out the key deficiencies or key weak areas in your practice that need to be improved. So you need to make sure these people are in place now, not tomorrow, not later. It should have been in place yesterday. So it's very important that you focus on this component of your practice right away. And lastly, because all three of them involved, is the workflow. Workflow is the key component because your workflow is going to change. It's going to change for the better. If you think that this workflow change is going to be a hurdle, it's wrong, because the workflow change is going to make your practice so much more smoother, efficient, but it's going to be a learning curve. You have to make sure your workflow setup incorporates processes and systems which are very critical for the practice and common to both programs, ICD-10 and MU2, for example, order management, clinical documentation, the accuracy and detailed clinical documentation, access management, health data exchange. These are the key components to focus in your workflow. And also you want to make sure that you develop vendor relationships and communication with your third-party payers to ensure that their priorities meet your practice's implementation schedule and strategies, because that's very important. You may be ready with ICD-10, but if your clearinghouse, third-party payers, and billers, coders are not, that's going to be a problem. And know that October 1st, 2014, you need to process your claims with ICD-10 codes. And if it's not, you don't get paid. So it's very important that you put a lot of priority on ICD-10 implementation. You need to have a software that can code ICD-10, provide you code. You should start practicing it right now, practicing coding for your visit right now. That will help you document better, because once you see that you won't be able to get that specific ICD-10 codes, it's going to ask you a lot more questions for your documentation purposes, so that it will help you document better. And those are the key things to focus on. Practice, test, practice now. So by October 1st, you are fully ready.
And MTBC can help you in at least two of these three steps that Dr. Gupta mentioned. First, in terms of the technology, MTBC has a 2014 MU Stage 2 certified EHR. In addition, we plan on having a ICD-10 compliant EHR as well. This will take care of your technology hurdle in this case, because it will make sure your EHR has met these two rules. In addition, in terms of technology, we also provide you a PHR, which lets your patients access the information you put into the patient portal, and also it also lets you to send your patients your clinical decision support within the EHR. Finally, we also help you in terms of your workflow. One of the things MTBC does is we maintain a third-party clearinghouse, which is MDION, who told us they would be certified for ICD-10 implementation at the deadline that Dr. Gupta mentioned. So in order to meet this, we've also encouraged our partners to also meet us halfway and provide you the best transition possible for these two regulations. Now that we talked about the timeline, hopefully in our next webinar we can talk more about what the requirements are for Meaningful Use Stage 2 and what time the provider needs to implement these changes and who within the office are responsible for these changes, so we can delegate responsibility equally among the practice. Thank you for paying attention to this webinar. I'd like to thank Dr. Gupta for his time and his explanation on the requirements for ICD-10 implementation and what are the 3 key important things that you have to focus on. You can obviously contact Dr. Gupta at askgupta@mtbc.com. You can contact me at my office line, 732-873-5133, extension 134, or contact MTBC's help desk in specific to Meaningful Use Stage 2, which is 732-873-5133, extension 308. MTBC looks forward to answering all your questions and possible concerns regarding Meaningful Use Stage 2 and ICD-10. Please feel free to reach out to us at any time, as we offer 24/7 technical support as well as MU Stage 2 support, and we'd really like to assist our providers towards this regard. Thank you again for your time, and again I'd like to thank Dr. Gupta. We hope to see you again in our next webinar, and have a great day.
Thank you, Praveen.